We'll move on to the next session, which would be moderated by Mr. Shantanu Chatterjee on digital transformation for responsible care. As panelists, we have Mr. Rajiv Mondal, CEO of Arakan Miptisoft Solution Private Limited. Mr. Mondal has been, or Arakan has been, an incubator of the Webel BCC&I Tech Incubation Center. Now he has accelerated. Mr. Sudip De, CIO and CISO of Aster DM Healthcare India Limited. Dr. Rajesh Gupta of Chief Digital Health Mind IT Systems. Mr. Venkataswarlu, IT Head, Woodlands Multispeciality Hospital. So I would request the moderator, Mr. Chatterjee, and the panelists to please join us on the dais. We'll just take few seconds to have a photo opportunity with Mr. Vikramjit Singh. We would like to again, express our gratitude, Mr. Singh, to travel all the way to Kolkata. I think he's based out of Gurgaon, to be with us today and make the presentation on the thought paper. So our next session, as we mentioned, the panel discussion on digital transformation of responsible care, moderated by Mr. Shantanu Chatterjee, having in the panel Mr. Rajiv Mondal, Mr. Sudip De, Dr. Gupta, Mr. Venkataswarlu.
Good afternoon, everyone. So it's always a privilege and also easy word when you have a panel which has been not only, I would say, thinking about, but they are the doers. So basically we have an extinguished panel with us who are not only thinking what is to be done, but actually on the ground doing, executing, and really at the forefront of, obviously, in terms of doing all the things in terms of digital transformation that we have been talking about. So if you think from a topic point of view, that we are talking about digital as a theme, and digital as a theme which has a transformative edge, and also something which has been the theme of the session today is in terms of being responsible, how we are looking at it. So I tee off with something which I spoke before also. It's a responsibility for each of us as individuals, as stakeholders, and as ma'am mentioned in the previous saying, that being co-part of this vision. So it is not enough to think that it's a government of India, it's a state government, or it's some regulatory body whose vision is to drive this. And it's a good food for thought for each of us, that how are we contributing our bit. And I don't want to quote Kennedy's famous quote, what he said, but this is not about it. How we contribute our bit, how we think that we are part of this vision and not something which is thrust on us. And most importantly, what are we doing in our day-to-day work, operations, running businesses, providing that care, which touches upon this aspect, which is being responsible, which is being cognizant about some of the rules and regulations. And very importantly, if I were to take that word which Vikram, my colleague, said in terms of creating that trust among the patients and the fraternity, that the care that is being delivered is safe, secure, and trustworthy. So with that, I will tee off, and I will basically, as I'm saying, is invite thoughts from across the panel. Maybe if I can start with Venkat, just because you're on the most left side on it.
Thank you, Shantanu.
Yeah. So as you are growing with the transformation at your organization, maybe you can throw some light that how are you as using digital, obviously because that is at the forefront, and what is that definitive thing that you are doing to create the trust among the patients, create that, I would say, experience, as to say. So if you can share some lights, that would be good. Thank you.
Thank you, Shantanu. It's a very good question. See, as a Woodland multi-speciality hospital, we have done a digital transformation journey. Around September 1st, go live went happen. It's completely, we have around 20 years of legacy data which has been transformed to the new HAS system, as well as my financial system is in SAP financial system. And inventory management also in the SAP also. So we have done complete transformation journey in terms of HIS, in terms of SAP, and some more other tools like a mobile app, chatbot, and many other feedback management system also, which has been transformed. That means the complete legacy transformation has been happened into the digital. Now patients are getting the reports via through WhatsApp, whatever the booking an appointment through chatbot itself only. All the data now it has been completely in terms of the digital platform, which it was not there earlier. So if patient want to book an appointment, he will go in the chatbot, he will book an appointment directly there to the doctor, and he will come into the hospital directly. He went to the cabin, kind of a thing. So there will be a token management, queue management will be there. When you are talking about the data security perspective, when there is a especially DPDP Act, right? Nowadays, the digital world, you know, right, there is a lot of threats, okay, from the cyber attacks. If you protect more also, there will be a lot of attacks. So what we have done in the Woodlands Hospital also, we regularly do a checks process and compliance. Regularly we do a VPD audits, and if you ask me in infrastructure wise, regularly we check infrastructure patching has been done in the network layer, server layer, application layer, that kind of a protection, and we have a kind of a one visibility tool where I can get that information, where is my security stance actually. Because IT will only the enabler part, right? In the business, the people who are the sitting like a doctors, nurse, patients, everybody, will combinedly collect the data, and we need to form a process in the business process also. So training is very, very key actually. When we tell to the end users also, go, protect, follow the process, and review mechanism. Let's say, I will take an example of nothing else, like in one of the person was left to the organization, still the email ID is enabled, still some application is enabled. So how do you do a review check mechanism? That's a very, very key important when you are talking about the review mechanism at each level, not only specific level, data security level. When you are talking about the DPDP Act, it should be a monthly checklist need to be happen, and with a business sign off, everything has been done, then only we take it move forward.
That's a very important aspect of how actually are you getting some of these things in action. So Rajesh, maybe you're just teeing off on that. Now we have heard about how things are getting done, but one of the points that I would like to reflect from this morning is that, see, one is all these things that we're talking as a compliance. The other thing is that how do I make that, and what I some of you make it something which is mainstream, part of, if I can use the word culture, may of my day-to-day activities. Islam, some speaker mentioned about the business process. How do I make this, the entire thing about compliance, trust, safety, in anything that I do, and which is obviously I'm taking patients, part of mainstream. Not something which is a good to do or maybe must do because of compliance or a stick in that. So any thoughts on that?
Thank you. So what Dr. Sumana Arora just mentioned in previous session, that we all have to be responsible individually, right? What has changed in last 25 years when I started my career in health tech per se, is that 25 years back, whenever we used to go for hospitals to sell softwares, the demand used to be like billing software, supply chain related administrative modules. But in last 5 to 10 years, and this is my personal experience, that when we go to any new hospital now to talk about technology, they all, without any exception, talk about clinical modules. They talk about EMRs, they talk about clinical decision support systems. At the same time, I always say that transformation is not about technology. Transformation is about people and processes, and then last piece is technology. That is the easiest part. Most difficult part is people. So unless we are getting more responsible day by day, that part is not going to happen. So I'm going to tell two stories very quickly from my personal interactions with different stakeholders in hospitals. And if it offends any of you, please forgive me before even I start the story. So I was in a meeting with a medical director, large hospital, and he also happened to be a practicing doctor. So, the meeting was regarding how to make sure that EMR gets into use. So the meeting started with all the pleasantries and all, and he started asking me questions like, tell me doctor, how do I use EMR when I come to the hospital? I have 60 OPDs, and I'm just quoting his words. 60 OPDs, I have 25-30 patients admitted, so I have to see these patients, then I have to go for a round, see 25-30 patients, then I have to have my break for a cup of tea or lunch, and then I need to go home. So he asked me that how much time will it take per OPD? So I said it should take 10 to 12 minutes on an average. So he said that means 60 patients into 12 minutes, or let's say 10 minutes, is 600 minutes, right? Then what about my rounds? So I said 30 patients inpatient will definitely take minimum 2 hours. Then he says, now see 10 plus 2, 12 hours. How do I use EMR? My answer to him was that, sir, let's take the technology out of this discussion. Forget about EMR. Help me understand how are you managing this without technology. It's humanly not possible, right? He said, somehow we are managing it. I said, no, let me tell you how you are managing it. You are managing it by compromising on quality, compromising on your documentation. Today, Indian population is still tolerant. We have very few medical legal cases coming into forefront, but people are getting more aware, people are getting more knowledgeable, more technology literate, and this situation will change. So you'll have more litigations going forward. Be ready for that, but how you are preparing yourself? I'm saying for technology is not to do anything else but to protect yourself. What EMR does, EMR only makes you more responsible. It assigns a responsibility and it doesn't allow you to bypass that. Paper gives you that freedom. So this is one story. Obviously the meeting ended on this note. I don't know what happened after that. But the second story is very simple. Again, another hospital, another medical director. She was also owner of the hospital. She said, I want to do EMR in my hospital. So I asked first question is that who is placing orders in inpatient? She said, doctors tell the nurses and nurses write on file. I said, you are not ready for EMR. First, you make sure that doctors are writing on paper. Even if it is on paper, it should be done by right person taking responsibility. So create it his problem. Right now it's not his problem. So when it is not my problem to write orders, EMR cannot be a solution for me. It could be a solution for nursing. So these are the very important basic stuff. We take EMR as a solution to everything. It is not a solution to everything. People part we have to manage. And once we manage that, technology adoption will happen, and all the things we discussed in previous sessions, the benefits, safety, all that will automatically happen. So I don't know whether I answered your question or not,
No, you did
but
that.
I wanted to share these two stories.
It's always interesting and useful to hear stories rather than sermons. So that's how I believe. So maybe Sudeep, moving on to you. In fact, there is never a discussion where we don't talk about AI, right? And especially if it's like last week when we had. So with an AI-driven world, let me call it AI-driven, it can be any other verb. What do you think are some of the fundamentals where the guardrails are either there but not visible, or in some cases not defined, although there were a couple of the frameworks which were launched and which was Bodhi and all of them. But what do you think are the practical nuances? And you have worked in multiple of the, I would say, caregivers and care providers. What do you think are the current Indian scenario? And I'm using India because that's where we are. with regard to some of these guardrails and maybe then a light forward of how we are going ahead. Thank you.
So Shantan has always told that no theory and only stories, so you will only get stories. My name is Sudeep, and yes, in 3 sections. I thought I will get an easier question, but I am asked again about AI. But it's okay. We have done our experiments, and we are using AI in 2 ways. One, wherein we are developing some bit of AI, which is the first way we started off with. It has been a learning journey. And when I started off, today I feel that even today, as a modest person, I would like to say I have not known anything and I am learning. However, when I started off, actually I did not know anything. And neither did my organization. Of course, we did some courses, went to some universities, understood, heard a lot of partners. They were all very useful, but it did not prepare us for the complete path. So that is when we had 2 streams of AI projects. One, like in digital transformation also, we had one stream which was focusing on healthcare provider being efficient and trustworthy. Vikramji said trust is very important, and I also feel so. Trust is also very important because we have to make sure that we are treating you the right way, not just for the outcomes but also financially. So majority of the focus was there. Similarly, and the second one of course was clinical, making the outcomes better, first of all making the outcomes regulated and reported. So that was in digital transformation. Same went for AI as well. In AI we had 2 streams of projects when we were developing. So if you can visualize, sorry I don't have a board to explain. One which was business oriented. So we were working on our claims being given to us or paid to us in full. Have you heard of the term called disallowance? Anybody from insurance or payer category? There is a term called disallowance. A disallowance is like 100 rupees is the cost, 10 rupees is the co-pay, 90 is to be given by the provider. Out of 90 we get only 85, 87 because there are certain things which are not allowed. They say that why did you perform this test, why didn't you take a approval? So disallowances to be prevented was the first AI project we did, and it became successful. Thankfully, we were helped by some governmental institutions also in this aspect, and now that is being used as a bolt-on in SCX. Second one was a clinical one, and I used to work for a cancer specialty hospital then, and we created a model wherein we are able to detect buccal mucosa cancers, and it worked beautifully for Maharashtra, 3 towns, and it was a journey, 9 months, 11 months actually to be precise, with the ideation part. Then we failed miserably and everybody lost hope. They said it's not going to work out. We failed miserably in the northeast states of ours. You know why, right? Any idea why we failed? Anyone? Sorry, we're not supposed to ask questions to audience, is it? It's okay. What is the specific thing? This is the kind of knowledge I had when I started off the project. But tell me what could have failed? Very commonsensical. And we were not able to say. We were disheartened for 3 months. Yes? Very close. Superbly close. 1 second. One at a time. 3 more answers. Very close, sir. Yes, ma'am.
I think it's anthropological difference.
Somebody is so very precise. They are genetically different.
Yes.
We did not account for different ethnicities.
Yes.
Yes. The third one is left.
That's
Yes, ma'am. Yes, sir.
Actually, my answer is the same. Your model was not trained with the proper data set actually.
Correct. Data set was proper. Some of the parameter got missed out.
Yes.
We had 48 parameters and there was a introduction of 4 more, which made then again we started, and it is still working in promiscuous mode. We have not gone through the SAMD model yet. SAMD certification is very mandatory. You asked about guardrails in your questions. Any software which we develop for AI like this has to go through a particular model to be a certified software for care provider. So SAMD guardrails are the better guardrails. The second part was, sorry Shantan, just 2 more minutes. There is a lot of tools which are available which is commonly used. So we also use those kind of tools when we have to dig out cases and do a multidisciplinary doctor board. Okay, so these are the 2 ways we have used it. Somewhere we have used tools which are already AI based. somewhere we are using two models, which is a long-term journey, and you need a subject matter expertise and not them getting disheartened through the process. So this has been the learning. I hope I have been able to answer.
No, thank you, Sudeep. I think you're keeping the trend of the stories there, because the end of the day we are collectively, our wisdom is in terms of the industry, the stories and the experience, and that's one of the things. So thank you, Sudeep, for getting it. Rajiv, if I were to just move on to you, we will keep the same flow and trend in terms of that as you are seeing some of these, I would say, transformation which are digitally led, I would say, because again, transformation is not only digital. What do you think are some of the pitfalls that we as fraternity, like you heard of one, right? That's where I got the cue for this, that we maybe know or we need to be cognizant of, for the reason that every community, every society, every country is different. So what are your thoughts? Anything that if you have come across would be helpful, and thank you for that.
So I'll answer this based on our journey through the different terrains of the country. We have worked in Northeast, Northwest also, as well as in Lakshadweep, the Deep South. So there are three major things we observed that requires to be addressed while digital transformation is being implemented or being adopted. First is the connectivity. Like there are different modules which are there, and they need to be connected. Like one should not run from one module to the other, and that connection should not be non-digital. So interoperable thing. Second thing that we observed is that the usability or the simplicity. It has to be very simple, because in these most of the part of our country, the people who will be using these tools, they are not digital savvy or they are not technology savvy. So we need to understand that temperament, and our tools that are being transmitted out there should be having those things into account. And third point is having a traceability and building the trust. So what we did was, like, we have developed like modules, we have developed modules where it is interoperable, like the clinic where the registration is being done, to the labs where the tests are being done, to the pharmacies where the medicines are being disposed. So all these modules are connected, and like a patient who is coming for the registration part doesn't have to go and carry paper to the other locations. Second thing is we introduced some connected devices, because we saw that if a lab person is doing the test and again have to write down and enter every data in the thing, so those becomes very difficult in those settings. So we have introduced certain connected devices for, say, blood analysis or urine analysis, or taking a ECG and automatically connecting. So these kind of things, tools we have added. And we have made the entire system language agnostic. Like it can be operated in, say, any South Indian language as well as any Northeast languages. So this is the way we have modified and developed our tools, so that it can be easily adaptable, and it is now being accepted in many locations, where very remote setting areas where people are using it.
Well, that's a good insight, because ultimately whatever we may talk about on the larger picture, it's very important to get this context of what is actually working. What are some of the small things that we learn which have a potential to then balloon up if we're not thinking about. So one aspect, maybe I'll just shuffle it around, so maybe Rajesh, coming to you, and maybe just quick one thought. As you think about some of these rules, regulations, what do you think is the key aspect for the private-public partnership? Which is to say that how do, as an industry, we partner very effectively with the regulators, so that it doesn't become a one-way street? Any quick notes and all, how we can do it better?
Yeah, I mean, a lot of public-private partnership is already happening. New hospitals are opening, like in Medanta has opened hospital in Patna, PPP model. A lot of hospitals, like yesterday I was in Bhubaneswar, so there are hospitals being built on same model. Like again, I'm quoting Dr. Sumanna. I have worked with her in Medanta, so I relate to her thoughts. So it's not individual, it's not only private, it's not only public. Unfortunately, public hospitals are in not great state where we all would want to go, but that needs to be upgraded. Again, there is a PPP which can be very, very effective, like certain departments are getting outsourced to private setups, particularly high-end ones like oncology, neurosciences. So that will continue to happen, and innovation from one thing which I think is need of the hour is capacity building, where new age professionals who come out from colleges learn how to be digitally enabled in healthcare. So unfortunately, when even now in medical colleges, when doctors are coming out, they are never taught anything about digital space. So they don't know what to expect when they go out. They don't know what is the benefit of EMR. They don't know what is the benefit of any other technology per se. There's a lot of awareness happening from non-education background, like social media, and AI is the buzzword. Everybody is using it. I personally use it. So that is happening, but there's no formal education in the colleges, and whether it is private or public, to educate healthcare professionals from technology perspective. So that should be, I think, the first initiative which needs to be taken.
That's a very valid point, because it's one thing to think about digital as a taboo. Second is to think as a myth. Fourth is to think as a promise. But the most important thing is to make it native. And that's what you're talking about. So how does it become native to each of us? So it doesn't become, I would say, one of the streams, it becomes the stream. So Venkat, just on that same tone, what if we were to just gaze in the future and take your context, what is that one digital innovation, whether you call it a hype or a current thing, which you think is really going to be there for India as a healthcare? What would that be? Thank you.
So if you ask me in terms of first I will tell you a change within ourselves first. If you won't change, we cannot do anything. So the change is, I'll take an example of EMR, which Rajesh was speaking about, the EMR of the doctors also. The adoption of the doctors of the EMR is very, very critical and very, very challenging task in the hospital industry. Why I'm referring this point was because I also faced a lot of problems when we implemented the HIS also in terms of total adoption of the EMR. It's very critical. So change is mandatory. Because if we want to grow, you have to change. You have to adapt the technologies. You have to, nowadays kids, you know, right? Kids are more faster than us, actually, if you ask me. In terms of technology, in terms of digitalization, in terms of social awareness, they are much more than us, actually, if you are going to ask next generation also. That is my thought, actually. Change is very, very key part to grow ourselves.
Right. On that similar thoughts, Deep, again, it can be a crystal gazing. But if you were to look at, like, we have been able to solve some of the access, some of the affordability, there was a question also in that. From a quality point of view, like where and how do you think is the digital means really playing a part? Maybe a quick take on it. I know end of the day it is quality care that you're talking about. Where does it really make an impact specifically? Any example? Like, story is not bad.
Story is not bad. All right. Precision medicine and personalization and patient engagement are the 3 Ps I would like to focus on, because a lot of it, in the last 5 years, I have been educated a lot on this aspect, because though I have been working in healthcare from 2012, And it was a very enriching experience to the point where we had hospital experience programs which allowed you to witness some kind of surgeries also with some of the doctors, and magnanimous work they do. But what I have understood is prevention is very important, and hence patient engagement. I am not saying wellness, that is a different sphere altogether. After the patient has arrived within the healthcare system for some kind of treatment, making sure they remain healthy, there is to be some level of engagement which is important so that they don't fall sick again. So patient engagement, I am going in the reverse order. Precision and personalization, because we are all different. And this got finally ingrained when I was in this healthcare chain, because I really understood how different we are. We are very, for normal course of treatments, for normal ailments, we can go, through clinical pathways. But for some very chronic diseases, it is better to be very individualistic, looking at so precision medicine, looking at your own self, that would be a key thing. So these 3 P's are important for me.
Thank you.
Yeah.
Just one rapid fire for you, Rajiv. If you were to just tell that, I don't know if you can share, what is that aspect that you are driven by in this, in your digital mission, as you are building on solutions and all, which is something which is futuristic? I don't know if it's something for you to share. I'll absolutely respect the answer that you give. Which you think is the one which is very specific from an Indian point of view? What would that be?
Yeah, like as I was saying, like the adoption, like we can go on developing many things, but if it is not going down and getting adopted, it's of no use. And the adoption comes with making it very simple. Like as I was saying, like most of the part of this country, they are not very accustomed to the digital tools or digital techniques, technologies and all these things. So the tools that goes to them needs to be very simple in their own language so that they can use it very easily. This is one thing. And second thing is, we have to understand these caregivers, doctors who are in these settings, they are already stressed with the amount of load that is coming. So the tools should be such that they don't have to do any additional thing in doing it. So that is where we are working on.
Right. Thank you. And I know we are topping time. So do we have time for questions? As Sharbani, Ongana, yep, maybe 2-3 questions. Audience, feel free, maybe 2 to 3. Let's see how it goes.
Yes, sir.
Not a question. Rajesh loved the stories. Digital as a theme is close to heart. So I just wanted to chime in. Sorry for butting in, if that expression, but then I think important. So we have an adage which goes on digital transformation. If you add technology to a broken process, you are rushing to failure quickly. So I think that's the part Rajesh was highlighting. If we want to really adopt digital transformation, first relook at the business process. There could be either re-engineering needed or at least well documented, everything clearly laid out. Then only we can adopt a technology solution, which is the part I would strongly recommend we first look at before jumping on technology. And second, I think everyone deliberated on, if I use a term, change management. Then very, very important aspect, if we were to bring any digital transformation, change management. And there's a lot of gaga about, okay, we need leadership support. Of course it is needed. We need to send lots of emailers. Of course, awareness is needed. But then 2 aspects we at times overlook, which are very important. Incentive for adopting the new process and empowerment for users to actually being able to do it. And I think the best example that we would really want to see is in UPI made available and people transacting 5 rupees transaction on UPI. We talk about technology, people not savvy, but you see even a seller who does not understand even a E of English, they are happily using it. They don't need any language. They are literally illiterate, leave alone English. They don't even understand their own vernacular. As in from a writing perspective, they are using it. So make it easy, empower. Those 2 dimensions need to be added. Thank you.
Thanks, Vikram. We're just adding on this empower and basically incentivize, and both go together. We can have the question from you, sir.
My question to Mr. Shruti, what would be the major, challenges for developing AI in healthcare? Already you discussed regarding the Bakka law, but like that, anything more to share?
Actually, we realized our data, we were very focused on the commercial part of healthcare. If I were to give one example, we were doing tests, diagnostic ones, imaging related. All images were also getting stored somewhere. I'm not saying without a system, but reports were getting manually made. If the reports are not there in the system to be correlated, how is that data? And this is on the surface of it. When you actually want to do for this, test, which was a mobile app based kind of test, we realized that the frequency during such exercises, the frequency of doing medication when it was given, all those medical data being normalized is far more complicated than even business data being normalized. So normalize the data, and my personal feeling is also every doctor and every administrator in my organization was very, very supportive about the concept. But we had to come back and say that we have to handpick use cases, curate data around it, and then work, because we cannot solve it for all. I can't say that I'm doing AI in every aspect. In oncology space, where we had at least 20 types of oncology and 10, 15 types of organs being detected or treated, we chose only one area. In total head and neck, we chose only area which was just buccal cavity, because that is where we started curating our data. It took us a lot of time to create a cohort of patients to work upon. And he alluded on clinical trials, and Pratik has been my colleague. He's sitting here quietly. We used to work together in a previous organization. But you know how difficult it is to have quality data being curated. So that is one of the biggest challenges.
Thank you. Thank you. Any other questions from the audience? Or else I think we would be good to wrap the session up. Hopefully we had some stimulating thoughts, some food for thought, as we say, some ideas to mull, and most certainly some call for action. Because end of the day, as I'm really resonating what ma'am said, Sumana ma'am, that it's us together as we make healthcare responsible, safe, and build that trust. Thank you. Thanks everyone, and thanks to all the panel members for making it interesting. Thank you once again.
Thank you, moderator and the panelists, for presenting such a very insightful session. I would request Mr. Shantanu Chatterjee to please present token of appreciation to the panelists on the dais.
I request Ms. Angana Gorai Chaudhuri, our Assistant Director General from the Bengal Chamber, to please present a memento to Mr. Shantanu Chatterjee, the Co-Chairperson of the Health Committee of the Bengal Chamber. I request all the panelists and the moderator for a group photograph, please.